Opzelura is indicated for individuals with non-segmental vitiligo, occupying up to 10% of their body surface area. But practically speaking, who is a candidate for Opzelura? Well, the patient that has noticeable patches on highly visible areas like the face, somebody who's very concerned about aesthetics and their social confidence and how they interact with the world around them. Perhaps the facial vitiligo patient that hasn't had success in the past, whether thinking about topical or systemic therapy. At the end of the day, it's absolutely crucial to think about the actual motivation behind treatment. Our patients are all looking for different things when it comes to thinking about their vitiligo, and it's up to us as dermatology healthcare providers to ask the right questions to understand the why behind their treatment. However, that's all changed with the arrival of Opzelura. Opzelura, or topical ruxolitinib, is a very different type of treatment than broad-acting immunosuppressive topical therapies. We're going to be reviewing 3 unique patient stories of vitiligo here today. Next, my patient Mark, a 32-year-old librarian with a history of type 1 diabetes and new onset light-colored patches on his face and scalp. Maybe we can rewind things to well before you and I had a chance to meet each other, and tell me a little bit about when you first started noticing changes in your skin.
Sure. So I had a new pair of glasses that didn't have a rim on them, and I started noticing spots on my eyebrow, and I thought that I was getting like a sunburn from the glasses or something. And then those stayed there even after I changed glasses, and then I noticed a spot growing on my forehead, and it was kind of like a dull, I don't know, like light spot. And then as it grew and grew, it started to get more and more defined. And I went to my primary care doctor, who then referred me to you. And my primary care doctor, he sent me in for a rash. He said he thought that it was a rash, and I knew it wasn't that.
I really want to kind of really hone in on this idea of really understanding the disease and understanding it in the context of you, because I know that we learned a lot about each other, and you told me a bit about who you are, what you do, your history of type 1 diabetes as well. And we had a chance to talk about vitiligo as an autoimmune disease, one that is perhaps in the spectrum of autoimmune diseases that maybe you are actually quite familiar with. What was your takeaway from our discussion of vitiligo, and how did that really change your desire to seek treatment?
I'm gonna be honest, like I really just kind of felt like, oh crap, like this is another thing that I'm gonna have to deal with for the rest of my life. So that was kind of, I guess, a little bit, I don't want to say like disheartening, but it definitely felt like another responsibility that I was gonna have. So on the other side of that coin, where I realized that this is just another, autoimmune disease that I'm gonna have to deal with forever, because I'm familiar with type 1 diabetes and I'm familiar with the treatment plan of having to do something every day, it wasn't something that I was afraid of or something that I was hesitant to do.
And I think it's Opzelura that really fit, for me, the boxes I wanted with something that was a targeted treatment that was both effective and safe and is really well tolerated and meant for the condition that you had.
It's definitely like a relief that there was something that was already out there available and that you thought would work for me. And it was easy, like it was something that I think it was something that I did work into my morning skincare routine. Like it was just another lotion, it doesn't hurt, it was easy to put on, and luckily I didn't have to use a whole lot of it at a time, so it really worked well with my schedule and with what I was already doing.
And can you take me through your first few weeks or even months on that therapy? What are some of the things that you noted that were changing?
I think what I noticed first was just kind of like a smoothing of the line. Like at its height, when my skin was really depigmented, there was a really sharp line that I could almost like box my face off, and I could see the skin difference. But when I started using the cream, it really like first softened the line, and then I could see my skin pigmentation kind of inch back to where it used to be.
When I think back on our experience together, you're definitely one of my fastest responders. And I feel like the fact that you notice some responses within even weeks of treatment is great, because we know that there's a whole spectrum of folks. Some that might take a few weeks to see responses, some that might take a few months. And that really inherently is the biology of a disease like vitiligo, where you're trying to accomplish so much in terms of really slowing down the inflammation, but also creating a habitat in the skin where you can drive repigmentation.
Before, when my skin started to depigment, there was another kind of like, oh crap moment where I felt like I was going to have to, not like go back in my shell, but for a long time before that, just like, I mean, anyone with any sort of like self-esteem issues or body image issues, it takes a long time and it takes work to get over that. And I felt like that was something that I had done up until that point. And when I started noticing my skin depigment in pictures, that really kind of took me back to that time where I was trying desperately to like force myself to like the image I saw. And so after this treatment worked, like I just felt better about myself and about the images that I was seeing of myself, you know, and it kind of feel like I feel more confident now as opposed to like pre-treatment.
Vitiligo is such an inherently personal diagnosis, personal story, and personal journey for treatment. It's really important to understand your patients, their background, how vitiligo affects them, and how they view treatment in their day-to-day life. Only then are you going to really be able to understand how best to approach care for the patient in front of you and how to optimize their self-confidence and well-being.